Medical professionals, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story?
Story 1. Not a personal experience, but one from a colleague of mine. I only saw the pictures. So, this 60-something-year-old suffers from an acute complication and gets a pacemaker to solve the problem. Everything goes normally and as planned. He recovers, every care and medication that he needs to take are prescribed, explained, and medical appointments with a cardiologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answer any calls from the hospital to know of him and reschedule. This went on for around 3 years, until he shows up without warning and asks to talk with the doctor that did the procedure to put in his pacemaker. People are weirded out by seeing that on that day, and the doctor was present, and this patient was in clear distress. They talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside his shirt. The man explains he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off, and there he stands, the shirtless man wearing his daughter's bra, showing off the pacemaker that should have been kept inside his body, dangling outside of it, being held up by the left bra cup, with a big, infected open wound above it, with the pacemaker leads still inserted onto his veins and connected to his heart. Nobody has any idea how the man let that situation come to be, or how he didn't die of sepsis or any other health problem that may appear for that matter. Too long didn't read, man gets a pacemaker, does not show up to appointments, 3 years later comes to the hospital looking for help, wearing his daughter's bra for 3 months to serve as a holder for the pacemaker that got out of his body from his infected open wound. It is insane how some people die because of a single knock to a certain part of their skull, and then other people will have an infected open wound leading to their goddamn heart and only get concerned after a few months. Hey, yeah, doc, I'm carrying all my organs around in these buckets. Do you have anything for when my hands get tired?
Story 2. I'm a dermatologist in India. As is the culture here, people eat with their hands, and almost all of our curries, or even other dry side dishes, have a lot of turmeric. It is common knowledge to anyone born and brought up in India that this means the nails of your dominant hand, statistically the right hand, are going to be yellow stained, because we have seen this happen since our childhood. Usually this wears off in about a day and a half if you wash it a couple of times. Cut to the first patient in my OPD, a young girl in her early 20s, very anxious. What brings you here today? Doc, my right hand fingernails keep getting yellow discolored. Only right hand? Yes, and only after meals. Do you eat with your hands? Yes, always. So you know it's just turmeric, right? Yes, but can you make it stop happening? For God's sake, use a spoon. So you mean there's no medicine to make it stop? No! This might hit home more with people of South Asian cultures or people who habitually eat turmeric-cooked food with their hands. Anyway, for a grown-butt person to complain of this was just, well, surprising and a little ridiculous. Story 3. I'm a pharmacist. One evening shift, I was working a relief shift, not my usual pharmacy. A man comes in looking distressed. I had, relations with a woman I do not intend to pursue a long-term relationship with. Yes, he said it just like that. Okay, I'm assuming there was an accident, or it was unprotected. How long ago did it happen? Last night, at 7 p.m. on the couch. Whoa, too much information. I just need to know approximate time to know if Plan B will work. We will have this medication called Plan B, and since the incident happened within 72 hours... Oh yes, I got that for her already yesterday, right after we finished. We want to know if there's anything we could do to know if she's pregnant now. Unfortunately not. She'll have to wait 3 weeks or so to see if she gets her period, and if she doesn't, then she can do a pregnancy test then. Theoretically, you could do a blood test for faster results, but that would also not be until a couple of weeks, at least. We're just really anxious because she really doesn't want to be pregnant. Is there anything that she can do to prevent the pregnancy? Any multivitamin, minerals, or food? She's already taken it, which was plan B. There are other options, but those are prescriptions. And no, there are no over-the-counter products she can take. What about me? Is there anything I can take now to prevent pregnancy? Any multivitamins or minerals? No, sir, there isn't anything you can take now. He just needs to disconnect the Bluetooth between his balls and the swimmers. Story 4. Physiotherapist. For those that don't know, after a total knee replacement, you basically have a 6-week window after the surgery to regain the range of motion. If you don't regain the range in those first 6 weeks, it isn't coming back. Had a patient who was a farmer who was very enthusiastic about regaining the range because he needed to be mobile for his work. Saw him for the first time about 5 days after surgery, showed him all the basic exercises, told him to not do any farm work for at least 6 weeks, and told him to come back to see me once a week for the first 6 weeks. He disappeared and came back about 8 weeks later. His range was non-existent, maybe 30 degrees of range in total. He was visibly mad at me, as if it was my fault, actually shouting and calling me incompetent. Our conversation went something like this. Have you been doing the exercises? No. How often are you doing farm work? Every day. Why haven't you come back since the first appointment 8 weeks ago? Too busy with farm work. So to summarize here, you did absolutely nothing that I told you to, and this is somehow my fault? Never saw him again. Story 5. Not me, but my mother would pick up shifts as a nurse, sometimes in labor and delivery, and she had met a handful of women who didn't know the baby was going to be coming out of their vaginas. Like, no clue. My mom usually said something like, "How you got it in is how it's coming out, honey." This was the late 90s, early 2000s. I'm a social worker, and one of my clients literally kept getting pregnant over and over after having kids. And I had a frank conversation with her about birth control or getting her tubes tied because she kept going through horrific births, only to get her kids taken away. And she actually said to me that she didn't know that birth control or protection would save her from getting pregnant. She didn't realize that sleeping with someone equals pregnant because she was abused as a child, and her father told her that she could only get pregnant when she's in love, and she had never been in love, so she didn't understand why she kept getting pregnant. It was only for pleasure for her, so she didn't realize that was what was having her get pregnant. God, that's awful. That poor woman. Part of me wants to not feel bad for her because she also trafficked her oldest, but I honestly don't think she thought it was wrong. She enjoyed doing it and claims to have enjoyed it when she was abused by her dad. I truly don't think she thought she was hurting her daughter, but was giving her a good thing. There's some messed up stuff in this world. Story 6. 73 here, former clinical microbiologist long ago. Still, I found myself all over the clinical lab at times, not just infectious disease. So, one day, this 20-something-year-old guy, wife and mom in tow, walks in with a paper request for semen analysis, pre-computer era. Okay, not the most comfortable encounter, but I'm a professional and did this drill many times. He had not been briefed by the doc and had no idea how establishing infertility in males was done. Well, okay, a challenge then. I took him aside and, using standard medical terminology, told him how a diagnosis is made and what he needed to do to provide a specimen. He couldn't and wouldn't believe that I was asking him to jack-o'-lantern into that container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half hour later, he emerged from the bathroom with 2 inches of urine in the cup. God almighty! The report went back, patient provided improper specimen. From personal experience, the doc probably did explain the process in excruciating detail, and then the guy peed in the toilet to practice. Want to bet that the reason this dude was having fertility problems was because he was giving his wife the wrong sample? Story 7. Working at midnight in the ER, family brings in a 4-year-old at 2 a.m. I ask them what's wrong. Ask him, the 4-year-old. He said he needed to see a doctor. Did he say anything was wrong? No, he said he needed to see a doctor, so brought him. A quick back and forth that firmly establishes that they actually showed up in the ER at 2 a.m. purely because the 4-year-old said he needed to see a doctor and they don't know why. Me, to the child, why do you need to see a doctor? The doctor has suckers. To be clear, it is the parents who lack sense and not the kid. The kid is smart. All I have to do is say I don't feel well, and they take me somewhere to get a sucker. Downside is, the next time the kid actually needs a doctor, they will probably ignore him. Story 8. Saw a chart once where a person came in for a burn to their eye. They told the doctor they read online that warm milk in the eye can help with irritation, and their eyes were irritated. So they boiled milk and then poured it in their eye. Burned it all. Reminds me of that tweet. Someone went to their optometrist and he said, "You can put some boiled water in your eye to rinse it. Look at me. Look at me. Let the water cool down first after you boil it." Like he knew that they'd dump a rolling boil right into their cornea without very explicit instructions. There's something poetic about an optometrist yelling with increasing intensity, "Look at me," while trying to help someone with eye problems. I love that tweet that made the rounds about a doctor that said to rinse the tweeter's eye with boiled water, then to emphasize not boiling water, water that has been boiled and then cooled. Do not put boiling water in your eye. It's amazing how stupid people can be. Story 9. Had an 18 or 19-year-old girl come into my ER with some complaint that required an x-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never slept with anyone, and there was zero possibility of pregnancy. We did the test anyway, and it resulted that she was pregnant. We did a blood pregnancy test to confirm the results, since she insisted she couldn't possibly be pregnant because she's never slept with anyone. That was positive too. We gave her a few minutes to herself to figure out what the heck happened, and when I returned to check on her a short time later, she asked me if she could get pregnant even though her boyfriend didn't go all the way in. She 100% believed that as long as his penis wasn't entirely in her, it didn't count as doing it. It took her nearly half an hour of explaining reproduction to her for her to understand whether it's halfway in or all the way in, sperm travels. What do you call guys that use the pull-out method of birth control? Fathers. Story 10. Pharmacist here. I had a woman bring in a literal sandwich bag, unseparated, which she kept all her meds in. She needed help seeing which meds she was low on or out on and asking different questions on the medications. When she pointed to an Epoch stating it was her blood pressure medicine, I immediately became concerned as to why pet medicine was in her bag. Also, why she is mixing all her meds in a bag in the first place, only to find out that she had been throwing her pet's med inside her bag of medicine. So Lord knows what she's been giving her dog or taking herself. I immediately stressed how important it is to keep medicine in its original container to protect the medicine and herself and to know the directions of how to take it. I've seen her a few times since then and glad to see that she has taken my advice. But how any pharmacist or doctor hasn't advised her on this before is beyond me. Story 11. Rural ER doctor here. 35-year-old female walks in with right-sided jaw and neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to. 10 minutes later, oh yeah, and I accidentally swallowed a bee and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. A friend of my mother's passed away from a wasp that got into his drink. He swallowed it. It stung him on its way down. And despite having no allergy to stings, the swelling was enough to close off his airway. Okay, new fear unlocked. I am already paranoid about bugs going into a drink can, and I won't drink anything I left unattended for a while. But that's just awful. Tons of replies. Just want to say I'm even more horrified now. This is not as rare as I thought. Story 12. Had a buddy who was an EMT. He was called out to a location for a gunshot wound. Apparently what happened is a father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawnmower, pulled out his pistol, and shot it. The bullet ricocheted and hit his son in the leg. My brother shot himself with a ricochet while hunting one morning before school. Dad had the doctor write that he was missing school and later PE due to the gunshot wound to the leg in his note. That note is now framed and hanging in the living room. He's oddly proud of it. No clue why. Gun safety is a huge deal to him. We weren't even allowed to aim Nerf guns at people or pets. I mean, he's seen how it can go wrong, so it makes sense he's extra paranoid about it. Story 13. Not me, but my wife, who's a vet, had a client who got mad at her because he didn't realize that once he neutered his dog, that he wouldn't be able to breed it. As someone who worked at a vet office, I am completely unsurprised. We once had to explain what smegma was to very embarrassed owners of a new puppy who brought him in for discharge around his wiener. Not to mention the countless people who bring their cats in asking about a lump, only to be told it's a nipple. And then you occasionally get the inevitable, but he's a boy, and have to explain that male mammals have nipples too. Like, ma'am, you are married. Have you ever noticed your husband has nipples before? I have nipples, Greg. Can you milk me? Story 14. Had an adult male patient who needed a Foley catheter. His mother was in the room, and they both lived together in the backwoods of Tennessee. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, "Well, he's still a virgin, and I'm not sure I'm comfortable with his virginity being taken in a hospital." I hope that was just a joke. Hell, I'd tell that joke. I wish it was hard to have a delicate conversation with this woman to explain that I was not taking her son's virginity. Urethral virginity is not one that I often consider. Story 15. Paramedic. Elderly woman complains that her mouth is dry and she felt a bit dizzy climbing the stairs earlier. Go through the whole rigmarole of getting a medical history, vitals, more detail on symptoms. Ask her what she's had to drink today. A cup of tea, 10 hours ago. Any water? No. Guess what fixed it within 5 minutes? Story 16. My sister told me a story of a woman with chronic blisters and lesions on her lips. They couldn't figure out what it was for weeks. It would heal and come back, heal and come back. Turns out she would jam out on like 3 bags of salt and vinegar chips a day for weeks at a time until the sores hurt too bad to continue. Then she'd go to the doctor. Story 17. Physical therapist. Had a patient with neck pain and spasms. Also complained of anxiety and heart palpitations. Asked about caffeine intake, and the patient revealed drinking an average of 15 to 20 cups of coffee daily. Story 18. There's a reason the instructions for prescription suppositories say unwrap and insert, and not just insert. Do not speak orally. Story 19. Once a guy came into the emergency room because he snorted a random white powder found in a plastic bag left on a random bench in the middle of a sketchy park, and started feeling seppukutal. Are you sure he wasn't seppukutal before snorting the mystery powder? Please leave your stories in the comments. I'd love to make a video of them in the future. Also, don't forget to like and subscribe.